think that it is a fantastic opportunity to have a mix in your career of both chronic patients where you get a lot of continuity of care, you get really strong relationships, but also you get a mix of acuity, you get a little bit of procedures, and for those that are interested, there's really opportunities to do research. Even on a small scale, you don't have to do research all the time, but there's also there's collaborative opportunities to do research. And also, if you really want a research career, you can do either a bench research career, a translational research career, a clinical research career, and there's so much we don't know. So there's really a lot of opportunities for us to learn.
I have friends who are clinical pediatric nephrologists, so they do clinical work, they do hospital rounds and clinic. There are many people that do research as well. You can have pretty much any type of job combination that you'd like.
I'm also interested in pediatric nephrology medical education. I'm passionate about pediatric nephrology. I love teaching about it. I'm a pediatric program director, so involved in medical education, and I hope some of my passion rubs off on my students and residents, just like the passion of my mentors rubbed off on me.
Some people are NIH-funded researchers, some people have labs, some people do some clinical research and mostly take care of patients. I think there's a wide variety of things. There are people who run dialysis units, there are people that concentrate completely on transplant. So there are a lot of different niches.
Many people don't know that nephrology has a long and very proud history of being involved in advocating for issues of importance for child health. We have had a legacy of many senior nephrologists who are not only involved with advocacy issues themselves, but have established programs to help nurture young nephrologists who are interested in advocacy. So I've had the good fortune of being a part of the John Louis Foundation Scholars Program, which is a sort of a fellowship within my fellowship, where I get specialized training in how to advocate for issues of child health, particularly those issues that are important to the field of pediatric nephrology. I've actually recently returned from the American Academy of Pediatrics Legislative Conference, where I went to DC and spent time with several dozen other pediatricians, met with members of Congress and their staff to advocate for issues that are important in child health.
You may find that the limited exposure you get as a resident or a medical student might not be enough for you to really see the full breadth of nephrology, because you only see a small part of it. And so doing that elective might help you kind of understand the relationships that people have with their patients, and the kind of diversity that we have in terms of careers and options.